morning, everybody, and I am so excited to welcome back Nicki Shepherd, first of all. So Nicki joined us a while ago and talked to us about the link between heavy metal toxicity and the biological effects, the link to the biological effects of EMS. So that's really, it's great to have Nicki back. Welcome, Nicki.
Thank
and
you,
I'm delighted also to say hello tonight to Dr Marina Carew. I hope I said that right. I've not.
Yes, you did, but just call me Marina.
Good. So Dr Marina, she's been a holistic dentist for many years, having previously worked for the NHS for quite some time. But after a very serious car accident, Marina found herself out of work for 7 months. And there was a massive chain of events that followed that, as is often the way, drastically changed her life and the way she practiced dentistry going forward. Marina's now enjoying semi-retirement. She's enjoying a grandchild and another one to come, and weddings and all that great stuff. And she's been helping people with their health using her years of experience and knowledge. So welcome, Marina, and welcome back, Nicki.
Thank you.
Hi, Lisa. Hi, Nicki.
Hi.
So I'm going to hand over to Nicki because I know your story, Marina, and it's an amazing story. I also know Nicki's, and somehow your two stories have overlapped, and you created a great friendship, but one that has helped Nicki a lot to deal with her health issues. So I'm going to hand over to you. I'm just going to butt in when I've got a question for the audience, but otherwise I'll leave it with you.
Thank you. Well, I was very unwell myself some years ago, and I was going down the rabbit hole of making the connection between gut health and oral health and the immune system. And I had many years of dentists, had lots and lots of interventions that one by one made me sicker and sicker. So it didn't take long for the penny to drop on that. And then I did meet some other dentists who were holistics, but had kind of helped, but hadn't quite got me there. And then I came across Marina, and then we just had a couple of appointments where she just blew me away. I mean, some of the conversations we had were just things that I'd never heard before. You know, talk about holistic. It was really, look, all this information about the jaw and how important it was to the whole body structure and the posture, and everything made sense to me because by then I'd only kind of scrabbled around on the internet and was researching this stuff. So I really met her at the right time. And I don't know if you remember, Marina, there was a conversation about lifting the bed head up.
Oh yes, inclined bed therapy that I actually learned from Clive de Carl.
All right. And then you fitted me one of those braces that go inside the ALF device, which nobody was doing stuff like that, and it was really exciting. So I got the device fitted, and it worked really well. But what's disappointing, I think, is there's such a shortage of holistic dentists. And now we find ourselves in this situation so many years later, and I'm constantly hearing people ask, where is their holistic dentist? Because people have woken up to this, they've woken up to the fact that a lot of these procedures are quite damaging in the mainstream, and they just don't know where to go or, what to do about their situations. So how did you get into holistic dentistry, and why did it all start?
Well, I was an NHS dentist for quite a while, and then decided to open my own dental practice near Stansted Airport. So I opened my own practice. I had 2 small children when I did that. Then I had a third, and then number 4 came along, and I was a vocational trainer. So that meant I was training the newly qualified dentists in the NHS for a year. And I had this fantastic trainee And I managed to get a locum in place, and I gave birth to my fourth child. And when she was 3 weeks old, I had a car accident. I had all four children in the car. I'd been bombing up and down the motorway because one of my children, the eldest one was in school in Cambridge, one was in Bishop Stortford, one was at nursery near Stansted Airport, and then I had the baby. And I did have a day nanny come in, but she wanted a week off. And I travelled here, there, and everywhere picking up the children. And when I was driving home on the M11 back towards Stansted, the car swerved in the middle lane, and one of my children said, "Mummy," and I realised I'd nodded off, and I had a discovery, turned it over on its side, skidded down facing the wrong way down the hard shoulder. When it came to a standstill, it was on its side, and I made sure all the children were fine, and I could see all this blood everywhere. And I thought, what's that coming from? And I saw the end of my index finger of my right hand hanging off. And I just thought, that's not very good as a dentist. And anyway, the long and the short of it is, I got to Addenbrooke's, had the baby with me, got the children taken. It's amazing how aware you are. And I was still able to think about the police taking the children to my mother's, and I got to Addenbrooke's, and they told me I'd never work again because they were going to have to amputate my finger, or half my finger and part of my thumb, because I'd scraped that off the back of my right hand. And I had to have loads of surgery, nerve taken out my leg to put in my fingers, broken loads of bones. And yeah, I was told I'd never work again. And I'm a typical Aquarian, very stubborn. And I thought I bloody well will. And I did. It took me 7 months to get back to work. I had some fantastic patients who said I could practice on them. And I learned to write with my right hand again. And so I knew if I could, my handwriting is pretty good, even with my injury. And I realised that using a drill was the same as using a pen. So got back to work, but while I was off work, I decided to do some courses that I would never have done otherwise. And I met one of them was a course about braces about not taking children's teeth out. And I just thought I'd go along and see what it was like. I spent the weekend with my jaw on the floor because I could not believe what I was being told, and everything made sense. I could never understand orthodontics at college, just learned it enough to pass my exams and then referred all the patients out. And everything the guy said made so much sense about the airway, about the posture, about developing the arches to their maximum potential, probably not needing to take teeth out, and how much healthier it is, and you get a more beautiful smile. And I was just blown away. So that started me on my holistic journey. Then I met some dentists on the course who said, "Why are you still putting amalgams in?" And I thought, oh, because I thought they were safe. Why would they teach us that at dental school? And my mum, who's German, said to me, "Oh, the German magazines are saying that amalgam is really bad for you." And I said to her, "Well, why would they teach us that at dental school?" I just didn't want to know. But I went along to some Klinghardt courses. Dietrich Klinghardt, became a sort of deep Klinghardt groupie for a number of years. I learned loads of stuff from him about detoxing. And then I went on some chiropractic courses. And I just kept going on lots of courses to do with the jaws and the body. And it just made my life so much more joyful. And it also made me realise how awful I'd been, because my eldest daughter, I'd given her fluoride drops thinking it was the right thing to do. I changed their juices because the British Dental Association had accredited Robinson's Special R because it had sweeteners in it rather than sugar, which would decay your teeth. So, I was doing all that sort of stuff, thinking I was doing the right thing for my children. And I was absolutely horrified to know that I was actually probably damaging them. And that started me. And then when I got back to work, I thought, well, there's no way I can put amalgams in. I can't send the children off to the orthodontist and have teeth taken out. I've got to learn it all myself and do it myself. But I couldn't do it on the NHS because I would have had to put amalgams in. So I started up a holistic practice and never looked back. I had to stop being a trainer because I wasn't doing any more NHS work. And I found some beautiful premises the other side of Stansted Airport and set up a holistic practice and had chiropractor come in and cranial osteopath and a homeopath. So it was just my dream.
Amazing.
And yeah, and then 6 years ago everything fell apart, but that was divorce, long story, I won't even go there. But yeah, I ended up losing everything, and that the worst thing was not being able to treat my patients. And yeah, I felt very low for a time, but then I thought, well, I can't be like this. I've got children, luckily they were grown up, and I thought I need to get back to helping people, and I didn't know how, but then I did find a way. And now I'm back into learning stuff, and I'm loving it. So, and I want people to know as much as they can about how dentistry affects them, how it affects their children, and what they can do themselves to make things better. And, you know, question everything. Even some of the holistic dentists, I'm, you know, a little bit dubious about, especially some of those who are big social media sort of celebs, because some of them, you know, are really haven't been doing it terribly long. And, you know, there is a thing about making lots of money. And there are some around who just have jumped on the bandwagon.
I was going to say, it's that old bandwagon, isn't it? And it can be quite lucrative if we don't keep our eye on it. So,
you know, and dentistry is expensive because the materials are expensive, the equipment's expensive, and you've got to remember that a private dentist has to pay for the premises, they have to pay for the staff, they don't get any help from the government, they don't get any rates left, you know, and the materials are very expensive. There used to be a little burner that you could buy, like a little Bunsen burner that you used to make creme caramel. There was one that you could buy because it was a dental one. It cost about 5 times as much as one you could get from a kitchen shop. But that's what dentists have to pay.
Is this why you think there's perhaps there's a shortage of holistic dentists? Because if we put a Google search in down in, you know, South Kent, there's one.
I think the reason why there is dentistry is expensive, full stop. And my personal opinion is that, I'm going to sound really awful, but I think the dental and medical students are not the same as the ones that I went to school with in general. We cared about our patients, and I find that compassion has sort of gone a bit AWOL. And I think, you know, I'm sorry if that sounds awful, but, you know, I just think that it's all about getting really academic students in who they can just teach to do what they want them to do at dental school and medical school and won't question anything. And I think a lot of them go into it because they think it's good money, and they give, you know, patient goes in pain, severe toothache, keeping them awake at night. All us old dentists, we'd have found, you know, if the patient needs a root canal, what we'd have done if to get them out of pain, made them numb, take the nerve out, put a dressing in. Nowadays, most dentists will give you a prescription for antibiotics. That takes 24 hours to kick in. It might not work. And the thing is, what are you doing to the gut? Why would you do that? Why would you let a patient suffer? And I think with a lot of the modern day dentists, it's all about veneers, it's all about cosmetic dentistry, it's all about putting Botox in, it's all about money. I'm sorry to say that, but that's what I see.
You can only talk about your experience and what you're seeing, and that's what we appreciate.
You know, I had to go to the dentist the other day. This is where I want to talk about amalgams. Amalgams, I know they're bad for you, and I would say don't have an amalgam put in. But if you do have a mouthful of amalgams, one of the things that I know a lot of, if you go and see a holistic, when I saw patients, let me tell you, when I saw patients who had a mouthful of amalgams, I never, ever, ever said to them, you need to have your amalgams taken out. That was their choice. And if they were happy and healthy, or they didn't believe in it, that was fine. Because I saw a lot of patients who just came to see me because they knew me from years ago before I was holistic, and they were happy to carry on with me. And I never felt that, you know, I should preach to them that they should have their amalgams taken out. And I do think that from my own personal experience, I had my amalgams removed about 20 years ago. White fillings are very technique sensitive, and they don't last as long as silver ones. Please don't think I'm saying have a silver filling. I'm not. I'm just telling you what the downside is if you have your amalgams removed. And I ended up losing 2 teeth, the last one 10 years ago, and I'm going to lose another tooth because the nerve in it has died because the filling leaked, and I couldn't feel it. With white fillings, you often don't feel it. With amalgams, you can feel, you get pain, but I didn't get any pain. And I went to see a dentist, and he was absolutely fantastic, because unlike any other dentist guy, so I had to see a local emergency one, and he didn't give me antibiotics. And when I said to him, "Oh, you haven't offered me any antibiotics," which I think is brilliant, and he said, "Oh, I trained in Bulgaria." And I thought, well, there you go. So but what I'm trying to say is that I've lost 2 teeth. I'm on the verge of losing another one. So when you have your amalgams taken out, there is always the risk, if it's a big one, that your nerve might die. Now, root fillings are not great. If you've got one, don't panic. They aren't fantastic for you, but not every root treatment causes problems in the body. Yes, there are people that will tell you they've had their amalgams taken out and they feel fantastic, but not everyone, again, feels great.
There are risks, aren't there? There are risks.
Yeah, and I think people need to understand that. If you've got a big amalgam and you need replacing, they can. If you've got a big amalgam, then the nerve can die in the tooth. If the nerve dies, then what do? Do you have a root filling? Most people who are aware about holistic dentistry don't want a root filling. So then what do? Do you have an extraction? If you have an extraction, how's that going to affect you? It might not have any effect on your body, but it could mean that the teeth either side tip in towards the gap, or the tooth above or below. If you've got a lower tooth missing, the tooth above could overgrow a bit. That could interfere with your bite. That could lead to problems with your posture. Or if you lose more than one tooth, your face can fall in a bit, and you end up losing some airway. It's a minefield.
Perhaps we should go on to that, actually. So the you were talking before about the jaw alignment and how important the joint the bite is.
Yeah, it's incredibly important, because right from young children, I remember reading a paper about in a Cranio magazine that was for craniosacral therapists and dentists, about little children that had ear problems and grommets, and if they were young enough, you could just build up the back baby teeth to move their jaws slightly further apart, and it would improve their eustachian tube drainage, and they wouldn't need grommets. And I tried it on a 3-year-old child who was due to have grommets, who didn't have any more ear infections. Same with the braces. If you make the jaws bigger so that you get the bite better, you get more height, then you solve a lot of ear problems, you solve a lot of migraine problems, clicking joints, posture.
People that the jaw has on the rest of the body.
People have no idea. No. They have no idea. So if you have your amalgam taken out and then you decide to have an extraction, you could then make your bite slightly different. And if that's the case, you could end up with a hip problem because your spine gets out of line. And they've done studies where they've got rats and they've built the teeth up so they're uneven on one side, and they took x-rays of their spines nice and straight, and they had these special little sort of boxes they put them in so that they could make sure they were all lined up properly. And then they let them run around for a few months. Then they re-x-rayed their spines, putting them in these boxes so they were all in the same position. And I think it was 80-something% had developed a scoliosis. Then they corrected the bite again to make the bite again even. And most of them reverted back to a straight spine, but not all of them.
That's crazy. We're serious, aren't we? Yeah.
So, if you take teeth out, you could end up causing problems with your bite, and maybe that's why down the line you might need a hip replacement.
Wow.
Or you might be getting neck pain or shoulder pain.
It is incredible.
It is, and every tooth is related to an acupuncture meridian. So I had a guy who had when I first learned this, I remember having a guy come in and he needed his wisdom tooth taken out. It was an elderly guy, and I said to him, if you had any heart problems, and he said, no. So I took his tooth out because it needed taking out. When he came back a few weeks later, he said, do you remember what you asking me about the heart problems? And I said, yes. He said, well, I used to walk up a hill every day and I used to get breathless. You took my tooth out, I don't get breathless anymore.
Wow.
Who knew? Who knew? So it all starts with childhood. So what I'll just go back to the amalgam things lastly. If you've got a whole load of amalgams, don't believe that, you know, you're going to get really well if you have them all taken out. That I've seen loads of people who haven't got well, and you could end up chasing things. So you end up, you know, maybe a nerve dying, losing a tooth, then you have to decide whether you're going to have an implant or a denture. Everything has a consequence.
Yeah.
And what I'm thinking now is I think a lot. My mum is 85. She's got mouthful of huge amalgams. She's got 2 root treatments. Yes, she did have a small breast cancer about 5 or 6 years ago, but it's gone. She's we did some treatment with her, and she did have a lumpectomy, and she's still got her amalgams. She's still got her root fillings, and she's 85. She lives on her own. She has no problems living on her own. She doesn't need any help, no daycare. She's a bit forgetful. But it made me think, how comes my mum has got all these amalgams? And then it made me think, it's detoxification pathways.
Yeah.
So we need to be educating people on how to detox themselves. And it needs to start before, if you're going to get pregnant, before you have a baby.
Yeah.
Get your body detoxed and healthy, because we are being subjected to toxins all the time. And the Environmental Working Committee, they said that a baby gets 280 something, I think it is, and just under 300 toxic chemicals in the umbilical cord blood. So our kids are starting off with problems. And I've also been looking up, which I haven't managed to read the papers yet, but I've got them saved, about toxicity and how it affects development of the teeth, because I've never heard anybody talk about that. And I was just interested if there was something, and I found a few papers and about how lead can lead to impacted wisdom teeth. Who knew? But I haven't read the paper yet, so I need to really understand it. And I can come back and tell you about that another time.
Because the Western Price Foundation, most of their research is based on the fact that diet and nutrition in the West affects the narrowing of the jaw.
Absolutely.
So
but
toxicity must be very destructive as well.
But you see, I think when he did his research, it was in the 1920s, and of course we had more nutrients in our food then. We didn't have as much processed food, and the other thing is they didn't have as many toxins around.
Yeah.
So I think we need to be detoxing. I think that's the missing link. I think a lot of people talk about nutrition, which is great, and we should be doing that, but we need to be detoxing and getting those pathways clear, and then our bodies can use the nutrition properly.
Yeah.
Because if we don't detox, it's like having a garden full of weeds and you want to grow some lovely fruit and veg in it, and you plant it all gets choked up by the weeds. So why not weed it first, plant all your fruit and veg, and then you have to keep weeding it. And that's the way I see detoxification now. And how
would you recommend detoxing, Marina? Because
I used to do all the chlorella and the spirulina and cilantro, but that didn't really help me personally. It did help some patients, but not everybody. And so I just thought, well, you know, people do need their amalgams taken out because there's nothing that really detoxes you. And then 3 years ago, I was introduced to Root Clean Slate, and I wasn't interested in taking it at all because I thought I've tried everything. My friend persuaded me, and within a few days of starting it, I was waking up every morning with smelly armpits. So I thought, this is working. I started to have more energy.
Is that it all coming out of your body?
Yeah. I mean, it was only for a week, but I did remember thinking, if it's going to be like this forever, I'm not going to take this because I don't want to wake up every morning stinky. But it didn't last forever. But I started to have more energy. I started to lose weight. And then I added in some of their other products that they started to bring out, because I was there at the very, very beginning and I was very reluctant. I didn't want to take it. And I started to take their other products. I now know I don't need thyroxine anymore. To be fair, I did stop taking it before I started any of the root products because I just didn't want to. But I had a goiter, that's gone. I've had all my bloods checked, everything's fine. And that is all because of the root products. And so this is why my brain works into overdrive. And I'm thinking, well, why are we taking everybody's amalgams out when maybe we could get them to detox and then do it much more gently and slowly? Maybe they don't all need their amalgams taken out. I don't know the answer to that. I genuinely don't know. But I would say to people, instead of, because there are people who are not going to be able to afford to have it done. And what does that make you think? If you think to yourself, I'm never going to get better because I've got a mouthful of amalgams, how does that help? It doesn't.
No, absolutely.
So if you can find something that's going to detox you, and maybe we've had so many testimonials of people having health issues resolved, you know, even one of a baby recently, which was just absolutely magical. And so I just think, you know, there's something to all of this. Get your detox pathways working, and then your body can take care of it.
I agree, Marina, because the thing is, it's not just your amalgams, it's everything else, isn't
Absolutely.
it?
That's what I think about my mum. She was born in Germany, where she had lots of fresh fruit and vegetables, and I think a lot of the older people as well, where the fruit and vegetables were nutritious, they had raw milk, and so they got off to a good start. And now we're being bombarded with chemicals, glyphosate, and, you know, antibiotics in the milk, and it's just horrendous. And you think these poor babies, and I have seen on Facebook some instances where babies, when their teeth are coming through brown and decayed, and then the dentists are all having a go at the mum, saying stop giving your baby a bottle, and the mums are saying, I'm not bottle feeding it, I've been breastfeeding. And so you have to wonder why are their teeth coming through like that? And it must be because they're toxic.
Yeah. So that's a really good way to move on to the next thing, which is, Marina, that you're going to do some workshops for us, aren't you? Which is amazing. I think anyone that's listening now will agree that you are such knowledge, and what you've got to say is just such an education for all of us. And I know you're still learning, and you always talk about researching and learning, which is amazing for us. But we need to know about this stuff. There's so much we don't understand. So the first,
I don't understand a lot of it. I'm just telling you what I see and what I feel, and I want to be able to help people in the best, easiest way possible. And so all I can do is just tell them what I think and feel, and they do their own research, and if I'm right, you know, and it works for them, fantastic. And if it doesn't, then come back and tell me.
Absolutely.
I don't know everything, you know.
Definitely, it's the same ethos we've got. We don't have all the answers, but we can collaborate with people that have different opinions on a subject, and we'll present everything and do what works for you, but do your own research.
Absolutely.
So we're going to do a couple of workshops to start with. You've touched on the pregnancy and babies, and I think we're going to kick off with that one in the coming weeks. So anyone watching, we will put details in the description to this video. But, you know, in terms of mums preparing for pregnancy, thinking about clean products that they're eating. And
they're putting on their skin, and they're using in the house.
Absolutely. Yeah. I've got on this list, Italian grandmothers giving babies cranial massages.
That's right. Apparently the grandmothers, they massage the baby's heads, because when the baby's born, the sometimes the bones can just, because they're very soft, they can just stick together slightly. And so, you know, I would suggest anybody that's just had a baby, take them along to a cranial osteopath or a craniosacral therapist, someone who knows about babies. And there's the osteopathic hospital in London. Quite a lot of them will do newborn babies for free. But you know, it really is worth it, and it can stop colic, it can stop all sorts of things, and it, you know, it's just good for your baby.
And this workshop will cover that. It will cover breastfeeding positions, why bottle feeding is not recommended, etc., thumb sucking. There's so much. And what I found out just in our chat before we began this interview is that Marina is a good friend of Nikita Stark, who is our amazing ambassador, birthing ambassador for PHA. Nikita founder of When Push Comes to Shove. So I think that that's going to be a phenomenal workshop for people. There'll be so much interest in that. And then secondly, we'll follow up with another workshop, which will be tips for adults. So I'm very, I don't know what it is about talking to you, Marina, but I've been kind of wanting to pick my teeth while I've been chatting. I'm like, oh, okay then. Yeah, so that's going to be fascinating. So finding a dentist that understands TMJ. What's TMJ?
Your temporomandibular joint, the jaw joints here.
There you go.
Very, very important.
Yeah, and learning about dentures in older people, improving your bite, ear problems, migraines, academic abilities may improve if you can sort these things out, gum disease, benefits of tapping, and back to our heavy metal detox, which I just think is so key in everything we're doing right now.
Yeah, absolutely. But it's the glyphosate as well, everything. You've just got to get rid of all these horrible toxins.
Absolutely. No, it's been fantastic, Nicki, Marina, absolutely lovely chatting tonight. I think we're going to have a lot of people that want to hear more about this. So this was just a taster. We're very lucky to have you both on board. We've got Nicki now talking to us about the EMF Academy that's coming up. It's going to launch in October, so we will have another chat. We'll do another interview about that one and just fill people in on what's going on there. But there's some amazing stuff. Really excited to learn more from the dentistry side, as I'm sure everybody is listening. And let's get together soon. We will pop details of the workshops in the description. We will point you back in the direction of Nicki's original interview about the link between heavy metals and EMF. And we'll talk about the EMF Academy coming up soon too. So thank you, ladies. It's been wonderful.
Lisa. It's been lovely.
You're welcome. Thank you. And let's just help as many people as possible by educating them.
Absolutely.
In how to look after themselves, giving them their power back.
That's it. Empowering people, take control.
Absolutely.